Hey guys, this is Dr. Hub. Today we'll look at the case fatality rate. So in the case fatality rate, this formula directly it goes as the total number of deaths. So it is a total number of death, and this is nothing but it is due to the particular disease. So due to a particular disease, and this will be divided by the total number of cases due to the same disease. Total number of cases due to same disease. So then what you do is you multiply the entire thing into 100. So this case fatality rate is a good indicator. So it is a very good indicator. And this is for the severity of or the killing power of the disease. This is good indicator for the severity. So for knowing the severity as well as the infectious diseases. So there is no time interval used. So in this case there is no time interval which is used. And the case fatality rate is closely related to the virulence. The case fatality rate, it is very closely related to that of the virulence. Next we look at the limitations of the CFR. So the limitation of the CFR is that there is it's useful for chronic diseases is limited. So the use in chronic diseases, it will be limited. It is limited. And when you look at, because the period from onset to death is variable, so the period from onset to that of the death, it is variable. It is expressed as percentages, and the CFR is an incidence proportion. It is an incidence proportion and not a true rate. Next is the CFR. It may vary for the same disease in different epidemics. So it can vary for same disease, and this will be in case of the different epidemics. So let's look at the case fatality of a few diseases. So in case of rabies, it is 100%. Rabies, the case fatality is 100%, and this is especially if the symptoms manifest. So it's after the symptoms. Next comes the Ebola. So the Ebola is about 25 to 90%, average being up to 50%. Next we will be looking at the yellow fever. So in terms of the yellow fever, it is 15 to 20%. Then comes the chicken pox. So the chicken pox is nothing but it is 0.001%. Then the diseases with a high case fatality rate. So diseases with a high case fatality rate. So this will include, there is a tetanus, there is rabies, next there is botulism as well as Ebola. There is botulism as well as presence of Ebola. Then the diseases with a low case fatality rate, So this will include the leprosy trachoma, leprosy, L for leprosy, that is lowering in leprosy, and the trachoma, and the lymphatic. There is also the lymphatic filariasis. So this was all about the case fatality rate. To learn and grow daily, please do subscribe.